Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living, everybody. Jason Salas over here. Thank you so much for tuning in. On the far side of the set right now, the very lovely, very informed, and very knowledgeable of all things medicinal, Dr. Jitka Lom from ExpressCare. Welcome back, Doc.
Thank you, Jason.
Okay, so tonight we are talking about strep throat. Now, there's a difference between a sore throat and what can possibly be strep throat, but not a lot of people know this, that strep throat can actually lead to much more complicated and much more serious and potentially very, very damaging, I would say.
Right, diseases.
Yeah, and health complications and everything. So talk about what's the difference between a garden variety strep throat, maybe because either from excessive yelling or even something caused by the flu, and strep throat.
Okay, so sore throat, what you're talking about is when you have a sore throat, the question is, do you have a fever? Do you have swollen glands in the back? Do you have pus on your tonsils? These are things that lead us to think maybe you have strep throat. And strep is short for the word streptococcus. Streptococcus is a type of bacteria that can affect your throat and cause this disease. So most sore throats are actually viral. Like 80% of sore throats are caused by a virus, kind of like a cold in your throat. And you may have trouble swallowing, it may hurt a little bit, but it will go away on its own. Whereas strep is basically more serious, where there'll be a lot of swelling, again, pus on the tonsils, trouble swallowing, and fever. With that, you can get some other problems, such as a rash, red rash all over the body. We call that scarlatina or scarlet fever. That used to be a common cause of death, you know, before penicillin came around. And then the strep bacteria can also create toxins that then also affect your heart and your kidneys. If it settles on your heart, there's something called rheumatic fever that you can develop, where the valves of the heart actually get damaged during that illness, and then that creates a lifelong problem with your heart function. And the strep can also create those toxins that then go onto your kidney and create an inflammation of your kidney, where you can have kidney failure for a short time, or even high blood pressure and so on. Basically disease of the kidneys. That one usually will go away with treatment. But the one that we really want to avoid is the rheumatic fever, because that can cause a lifelong disability for your heart.
And I remember, like back in the 40s and 50s and 60s in America, if you had scarlet fever, they would have to quarantine you and possibly like burn everything in your room because they didn't destroy everything.
Right, they didn't really understand what was going on, and the bacteria that caused strep, there was no way to treat it. You just tried to support the immune system, but until penicillin came along, and then that was really a miraculous invention.
Now, penicillin has to be prescribed by a doctor.
Yes.
Yeah.
Lots of times, you know, I have patients who, let's say, have leftover antibiotics at home, and so they'll have, or from a friend or something, and they'll have a sore throat, and they'll start taking antibiotics, and they'll come in 2 or 3 days into their antibiotics saying, I'm taking this, and I still have a sore throat. Again, most of the time your sore throat is viral. So remember this, okay? If you have a sore throat, you don't have a fever, it hurts a little to swallow, but you look back there and it's just pink, there's no pus on your tonsils, don't take antibiotics, because it's not going to help you.
Now, there's a beautiful segue into our next question, because, you know, I had strep throat many, many times. When I was 9, I had strep throat every other month for like an entire year and everything. It was crazy. But I remember when I would go into the doctor's office, they'd say, okay, open real wide and say, ah, and they would always like put like a big tongue depressor or like a big Q-tip, and they do like a throat culture.
Yeah.
If I'm at home and I'm having like a sore throat, what can I look for so I can actually kind of like figure out, okay, well, you know, maybe I just got a cold, or maybe it's like something. What am I supposed to be looking for?
Okay, so first thing is your fever. Next thing is look back there. If you see big tonsils, swollen tonsils with like white stuck-on goo, that's pus.
What do the tonsils look like if we still have them?
So if you look back there, they're on the sides. You look, there's a little uvula, that's the little thing that hangs down, and then on both sides you have a tonsil, which is like a pink bump. Okay, on the back of your throat. And tonsils are actually part of our immune system. What they do is they produce antibodies. So when there's food or bacteria or viruses that are coming into our mouth because we've ingested them, there's a first line of defense. So tonsils are part of our immune system. And if they're inflamed, there's a lot of pus. It means they're working very hard to fight off an infection.
Interesting. I always wondered about that because, you know, like I try and do that at home, or, you know, how much do the inflammation of glands play into the difference between, again, a sore throat and possibly strep throat?
That's really good. So sometimes your tonsils may be inflamed, and you may also feel some swollen glands here in your throat, and those are lymph glands, and they're again part of the immune system. I compare them to barracks where there's soldiers, and when there's a battle going on, you need more soldiers, so they'll swell. Okay, so
Great
these,
analogy.
yeah, that's a good one. So then you have swollen glands. That's part of the immune response. So it's good when you have swollen glands because it means that you're fighting the infection.
Now, you mentioned rheumatic heart disease earlier in the segment. Is that something that's hereditary? Can it be passed down from generation to
No, not
generation?
at all. Not at all. So it's an infection. Again, if your child has a fever, you look in there, there's red tonsils and pus on them. You really do need to get them antibiotics, again, to try to prevent that bad complication, which is rheumatic fever. And the symptoms of rheumatic fever can be really very dramatic. We don't see it as much now because people do take their kids in, but I have seen it in my lifetime, and it's very dramatic when the child is actually short of breath and in congestive heart failure. They have a very loud murmur, they've got a rash going on, they've got some swollen joints. It's a whole bunch of symptoms, and then they need penicillin shots or IV penicillin for a while. If it's really severe and the valve is extremely damaged, they may actually require surgical repair of their heart valve later.
Okay, question, doctor,
Ask
if I
me.
may. So I've now been educated to the fact that I've got to look at my tonsils and see if they're swollen in the mirror. What about people that have had tonsillitis and have had their tonsils removed?
Great question. And also,
Coming
when
back
should
to
you?
that.
Yeah, and when should you have your tonsils removed?
Exactly.
Right?
Well, and these days they don't do the surgery anymore. You can actually take that. You can take oral medication to help that, right?
Well, most of the time you don't need to have surgery to remove your tonsils. But if you have more than, let's say, 3 or 4 proven strep throats per year, then there's a problem, and you really should have your tonsils removed. And you would see an ear, nose, and throat specialist, which we now do have on Guam, and to have your tonsils removed. And that's not very commonly done anymore, like you said. But if you've already had your tonsils removed, let's say as a child, now you have a sore throat, how do you know if it's strep? That's a great question. So if you have a high fever and you look back there and there's still redness on we call the pillars, the back of the throat, let's say back of the mouth, if you do see redness back there, or if it hurts a lot to swallow, the main things are hurting a lot to swallow, swollen glands, and fever.
Interesting. Okay, we are going to talk some more about strep throat and possibly the complications that could arise out of it on the flip side of this break. So please, everybody, stay with us.